Now we go to the 5 transporting points. The jingle points, Heart 9, lesser rushing. Heart 9 location on the little finger, point 1 tune lateral to the radial corner of the nail. How to find? This point is located at the junction of 2 tangents at the border of the radial and proximal aspect of the nail. Approximately 0.1 tune from the actual corner of the nail. Small intestine 1 is located on the opposite ulnar aspect of the nail. Needling 0.2 to 0.3 tune vertical or obliquely in a proximal direction. For acute disorder, pain, inflammation, prick to bleed with a needle, lancet or 3-edge needle. Caution is painful point. Heart 9, for the action and indication, it revives consciousness, clears heat from the opposite end of the channel, regulates Qi in the chest, and clears heat in the heart. Heart 9 also opens the channel. For the special features, Heart 9 is a jingle point, wood point, tonification point, and exit point. Heart 9 is mostly used in excess patterns with heat in the heart. It is similar in action to Heart 8 insofar as it clears heat, but like all well points, it is also extinguishes internal wind and can therefore be used for wind stroke. In this context, it is used to restore consciousness as it opens the mind's orifices when these are obstructed by internal wind. In accordance with the general action of the well points indicated in the classic of difficulties, this point relieves a feeling of fullness in the heart region. Summary of function, Heart 9 clears heat, calms the mind, those with palpitation, heart pain, thirst, feeling of heat. It also opens the mind's orifices, those with manic depression, pride, sadness, agitation, mental restlessness. Heart 9 also extinguishes wind for those loss of consciousness from wind stroke. It also promotes resuscitation, benefits the tongue and eye for those with pain at the root of the tongue, swollen tongue, eye pain, red eyes. Heart 9 is the jingle point and thus the terminal and most dynamic point of the heart lesser yin channel. Hence the name lesser rushing. It shares with the jingle points of the 12 channels 3 principal characteristics. Firstly, it is able to restore consciousness in case of collapse. For example, from wind stroke. Secondly, it has a strong action on clearing heat from the opposite end of the channel. The heart primary channel ascends alongside the esophagus and connects with the tissue surrounding the eye. The heart divergent channel ascends along the throat, and the heart Luo-connecting channel ascends to the root of the tongue and the eye. Heart 9 is effective to clear heat from the upper reaches of all these branches of the heart channel in the tongue, swelling and pain for the throat, painful obstruction and dryness for the mouth, heat and eyes, redness and pain, as well as being able to clear febrile heat, disturbing the spirit and giving rise to agitation and restlessness. Thirdly, the classic of difficulty states that the jingle points treat fullness below the heart. The region below the heart specifically refers to the apex of the epigastrium, but many of the jingle points in fact treat stagnation and fullness throughout the chest region. And Heart 9 is indicated for pain of the heart, chest, and lateral costal region. While its modern clinical use emphasizes the treatment of such excess disorder, classical text place equal weight on its ability to treat heart qi deficiency. Thus, the song of the Jade Dragon states, "What of disease of gold, gallbladder, and heart deficiency? Bilateral Heart 9 is the most effective, and the sum of the primary points of the HT14 channel similarly prescribe it for heart and gallbladder qi deficiency. Since Heart9 is the wood point of the heart fire channel, this reflects the principle treating the mother to nourish the child. Thank you for your attention.
Let's talk about SI4 or small intestine 4, wrist bone, source Yuan point. Location on the ulnar border of the hand between the fifth metacarpal bone and the carpal bones, on the border of the red and white skin. How to find SI4? On the ulnar aspect of the hand, palpate along the shaft of the fifth metacarpal bone in a proximal direction until the finger glides over the curvature of the base and into the cleft between the metacarpal and carpal bones. SI5 is located on the same line, proximal to the pisiform bone and at the level of the wrist crease. Needling vertically 0.3 to 0.5 Tsun. Caution, this is also a painful point. Actions, indications of SI4, clears pathogenic factors from the Tai-Yang channel, clears damp heat in the small intestine. Special feature, Yuan-source point. SI4 is mostly used for channel problems of the small intestine, extending its influence to the wrist, elbow, and neck. It is therefore used for painful obstruction syndrome of the wrist or elbow. In spite of its being the source point, SI4 is not much used for internal problems of the small intestine, for which the lower C, which is stomach 39, the front collecting or the front mood, REN4, or the back shoe points, bladder 27, would be preferred. An empirical use of SI4 is for hypochondrial pain, cholecystitis, and jaundice from damp heat obstructing the gallbladder. Summary: SI4 removes obstructions from the channel, like contraction of fingers, wrist pain, contraction of arm and elbow, stiff neck, pain in the shoulder, headache, pain in the lateral ribs. Resolves damp heat, as in jaundice, febrile disease. SI4 is the Yuan-source point of the small intestine channel. Its main clinical application is in the treatment of contraction, stiffness, and pain along the entire length of the channel, including the hand, elbow, arm, shoulder, neck, and back. It is one of the main points, along with LI5, Sanjiao 3, and SI7, to treat disorders of all the 5 fingers, especially when characterized by contraction and pain. SI4 has a specific effect in the treatment of swelling at the opposite end of the channel, especially the neck, cheek, and submandibular region. Like all the previous points of this channel, it is also indicated in the treatment of tinnitus, reflecting the pathways of the small intestine, primary, and sinew channels which enter the ear. This is an example of the use of acupuncture points to treat disorders of the channel rather than underlying Zhang-Fu disharmony, and SI4 may therefore be used in tinnitus due to any etiology. SI4 is specifically indicated in combination to treat pain and swelling of the submandibular region radiating to the ear and giving rise to tinnitus. SI4 has been found to be empirically effective in the treatment of different kinds of jaundice, whether due to damp heat or cold damp, as well as pain of the lateral costal region with inability to catch the breath. This action cannot be easily explained either by reference to the channel pathway or to the functions of the small intestine. Combinations: for contraction of the 5 fingers with inability to flex and extend, we combine SI4 with SJ3. For pain of the shoulder and arm, SI4 plus SI11. Pain of the submandibular region giving rise to tinnitus and difficult hearing, SI4 plus SI5, SI9, GB43, and GB44. Toothache and tooth decay, we combine SI4 with stomach 7, stomach 5, and SJ17. For pain of the lateral costal region with inability to catch the breath, SI4 plus SI5. And finally, for spleen deficiency jaundice, SI4 plus REN12. Thank you for listening.
Now let's continue with Heart 5, the penetrating the interior point of the Luo-connecting points. Heart 5 is located 1 tune proximal to the ventral wrist joint space, the most distal transverse wrist crease, on the radial side of the tendon of the flexor carpi ulnaris muscle. How to find Heart 5? We position the forearm in a relaxed fashion. The location of the ventral wrist crease is variable. Therefore, the proximal border of the pisiform bone provides a more reliable landmark. Heart 7 is located on the wrist joint space radial to the distinct tendon of the flexor carpi ulnaris muscle. Locate Heart 5 1 tune proximal to Heart 7, also on the radial side of the tendon. Located along a line on the radial aspect of the tendon are Heart 6, which is 0.5 tune proximal to Heart 7, and Heart 4, 1.5 tune proximal to Heart 7. And lung 8 is also located 1 tune proximal to the ventral wrist joint space, but on the radial aspect of the forearm. Heart 5 is needled vertically 0.3 to 0.5 tune or obliquely 0.5 to 1 tune in a proximal or distal direction. Caution, this point may be painful when needled. As for its actions and indication, Heart 5 regulates and strengthens the heart chi. It is the main point, and also regulates and strengthens heart rhythm. It calms the shen, it benefits the tongue, and benefits the bladder via the Taiyang channel, and opens the channel and the Luo-connecting vessels. Special features: it is the Luo-connecting point of the heart meridian. It is a Madanyang heavenly star point. It is the main point for regulating and strengthening heart chi. Heart 5 is one of the main points to tonify heart chi and is the point of choice out of all the heart channel points for this purpose. It is indicated in all symptoms of heart chi deficiency, and in particular, it has a marked effect on the tongue and is the point of choice for aphasia. Being the connecting point, Heart 5 connects with the small intestine channel. This in turn connects with the bladder channel within the greater yang. It is through this route that the heart channel can influence the bladder and urination. The connection manifests itself when heart fire is transmitted to the small intestine and from this to the bladder, giving rise to bladder heat. The main manifestations are thirst, bitter taste, insomnia, tongue ulcers, burning on urination, and hematuria. This point is indicated for enuresis. Here is a diagram illustrating the connection between the heart, small intestine, and bladder. As the connecting channel goes to the eyes, this point is indicated for heat in the eyes deriving from heart heat. Heart chi rises to the head and may cause headache and dizziness, for which this point can be used. The heart is connected to the uterus via the uterus vessel or the baomai, and Heart 5 is the main point to affect such a vessel in such problems as excessive uterine bleeding. To summarize, the Heart 5's functions are as follows. It calms the mind where there is sadness, mental restlessness, anger, fright, depression, and agitation. It tonifies heart chi, and there is palpitation, weak heart chi. It benefits the tongue in cases of loss of voice, aphasia, stuttering, stiff tongue. It benefits the eyes and head in cases of red eyes, eye pain, red face, headache, and dizziness. It also regulates the uterus in excessive menstrual bleeding and benefits the bladder in enuresis. Thank you for your attention.
We continue with the back transporting points, bladder 22, Sanjiaoshu. The location, bladder 22, is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the first lumbar vertebra, L1. How to find orientation in the lumbar region? First, determine the tougher line, a line connecting the highest point of the iliac crest, which in most cases intersect with the spinous process of L4. Note this varies depending on the patient position. From there, count upward to the lower border of the spinous process of L1, and of this level, locate bladder 22, 1.5 tune in a lateral direction on the highest point of the paraspinal musculature. Located on the same level, R25, on the midline, a point of EXP2, bladder 51, EXP4, 0.5 tune, 3 tune, 3.5 tune lateral on the midline. Needling, bladder 22, is needled obliquely 0.5 to 1.5 tune. Caution is the kidneys. For the action and indication, bladder 22 regulates the triquetral burner, opens the water passages, and promotes urination. It has an effect on Xiaoyang. Special features, bladder 22 is the back shoe point of the triquetral burner, especially regulates the relationship between the middle and lower burner. Bladder 22 is a major point to stimulate transformation, transportation, and excretion of fluid in the lower burner. The lower burner keeps the water passages open so that dirty fluids may be excreted. This point regulates this particular function of the lower burner and thus ensures that the water passages are open. Fluids are properly transformed and dirty fluids excreted. By stimulating the transformation and excretion of fluids, it resolves dampness in the lower burner and treats such symptoms as urinary retention, painful urination, edema of the legs, and any other manifestation of dampness in the lower burner. Bladder 22 invigorates blood and does so primarily by promoting the transformation and excretion of fluids in the lower burner. From this point of view, its function is similar to that of the herb Ceylon Herbalicopi lucidi. The effect of this point on the lesser yang channels and lesser yang pattern requires an explanation. As we have seen in chapter 3, the triquetral burner is like the envoy of the original qi, Yuan qi, emerging from the space between the kidneys. Put differently, the triquetral burner helps the original qi to differentiate into its different aspects in different parts of the body. Chapter 66 of the Classic of Difficulties discusses the connection between the original qi in this chapter called Dong Qi, motive force, and the triquetral burner. It says the original qi is the motive force situated between the two kidneys. It is life-giving and it is the root of the 12 channels. The triquetral burner causes the original qi to differentiate for its different uses around the body. The original qi passes through the triquetral burners and then spreads to the 5 yin and 6 yang organs and their channels. Bladder 22 is just above the bladder 23 back transporting points of the kidneys. So this is the area from where the triple burner helps the original qi to emerge from the kidneys and spread to the internal organs. Because of its connection with the triple burner, this point can be used for the lesser yang patterns. Moreover, the 1.5 June lateral to the bladder 22 is bladder 51, which, although situated in the lower burner has an upward movement, and it affects the breast and the area below the heart. For this reason too, although bladder 22 affects the lower burner, it also has an upward movement, and it can be used for headache and dizziness. So we have here the illustration, bladder 22 and the original qi. From the Yuan qi goes to the triple burner and goes to the 5 sang and 6 fu. So we have here the bladder 22 and bladder 23. The summary of function, bladder 22 resolves dampness, opens the water passages in the lower burner, edema, difficult urination, turbid urine, blood in the urine. It also invigorates blood for those with abdominal masses. And bladder 22 regulates the lesser yang, those with alternation of feeling of heat and feeling of cold, headache, dizziness, and bitter taste. Thank you for your attention.
Let's discuss REN4, gate of the source, Kuan Yuan, a front collecting point or an alarm point. REN4 is located on the anterior midline, Tutsun superior to the upper border of the pubic symphysis, or 3 Tsun inferior to the umbilicus. How to find REN4? The distance between the center of the umbilicus and the upper border of the pubic symphysis is divided into 5 Tsun, which can vary considerably from the patient's finger Tsun. Therefore, only proportional Tsun measurements should be used here. A helpful device would be an elastic tape. REN4 is located on the midline, either 2 Tsun superior to the midpoint of the upper border of the pubic symphysis or 3 Tsun inferior to the umbilicus. Located on the same level are kidney 13, 0.5 Tsun lateral to the midline, stomach 28, 2 Tsun lateral to the midline, and 3 extra points, extra CA, which is I Ching, 1 Tsun lateral to the midline, Chi Men, 3 Tsun lateral to the midline, T2O, 4 Tsun lateral to the midline. Also located on approximately this level is GB27, which is medial to the anterior superior iliac spine. Needling of REN4, vertically 0.5 to 1.2 Tsun. Caution, peritoneum. Needling contraindicated during pregnancy. Actions or indications of REN4: tonifies original qi or yuan qi, benefits essence or jing, strengthens and nourishes kidneys as well as blood and yin, eliminates cold and dampness from the lower burner, especially with moxibustion. Special features: front midpoint of the small intestine, meeting point with the spleen, kidney, and liver channels, important point for tonification, major point for urogenital disorders, especially gynecological disorders. REN4 is an extremely important point. It is one of the most powerful points to tonify qi and blood and strengthen the body and mind. First of all, it can be used to tonify blood and yin in any pattern of deficiency of blood and or yin. It nourishes yin firstly because a directing vessel controls all the yin channels, and secondly because REN4 is the meeting point of the directing vessel with the liver, spleen, and kidney channels. Dark phase is a sign of kidney yin deficiency. REN4 also strengthens the yang when used with direct moxibustion and can be used in this way to rescue the yang in the acute stages of wind stroke due to collapse of yang. It can therefore be used in any pattern from yang deficiency, particularly kidney yang. REN4 is probably the main point to affect the uterus and menstruation, so that it is used for most menstrual disorders. such as amenorrhea, scanty periods, irregular periods, or heavy periods. REN4 also has a long history of use for infertility. In menstrual problems and in gynecological problems in general, use REN4 in combination with the opening points of the directing vessel, lung 7 and kidney 6. It tonifies kidneys and original qi, yuan qi, and is a very powerful point to strengthen the general level of energy and the kidneys. It is thus an important point to treat chronic diseases or patients with a poor constitution. REN4 can tonify both kidney yang with direct moxibustion and kidney yin. REN4 can calm the mind and settle the ethereal soul by nourishing blood and yin. It can strengthen the lower burner in persons who are very anxious, especially if such anxiety derives from yin deficiency. REN4 tonifies qi of the lower burner, thus rooting the qi downwards and subduing rising of qi to the head, which happens in severe anxiety. In this way, it has a powerful calming effect. REN4 can root the ethereal soul and can be used for a vague feeling of fear at night, which is said to be due to floating of the ethereal soul. Its kidney tonic action extends also to that of strengthening kidneys receiving of qi, so that REN4 is an important point to tonify kidneys in chronic asthma. In such cases, REN4 is often combined with kidney 13. Some of the indications for REN4 pertain to penetrating vessel, as this vessel goes through REN4. Penetrating vessel indications for REN4 are feeling of cold in the lower abdomen, running piglet syndrome, abdominal fullness, and umbilical pain. When used to subdue rebellious qi in the penetrating vessel, we combine REN4 with the opening points of the penetrating vessel, that is spleen 4 and pericardium 6. REN4 also affects the bladder and is used for similar problems as those indicated under REN3. Although both REN3 and REN4 affect both bladder and uterus, we use REN3 more for bladder problems and REN4 more for the uterus. REN4 is probably the most important tonic point of the body, as it tonifies all forms of qi as follows: qi, yang, blood, yin, essence, original qi, kidney yin and kidney yang, directing vessel and penetrating vessel, defensive qi, and nutritive qi. Summary of functions: REN4 nourishes blood and yin, strengthens the kidneys, so good for lower backache, weakness, dizziness, tinnitus, feeling of cold in the back, dark face, frequent urination, impotence. Strengthens the uterus and regulates menstruation, so it's very good for infertility, cold sensation in the vagina, amenorrhea, bleeding in pregnancy, persistent lochial discharge. And REN4 benefits original qi. REN4 benefits the bladder, so it's good. It's indicated for retention of urine, dark urine, painful urination, blood in the urine. Subdues rebellious qi in the penetrating vessel, like feeling of cold in the lower abdomen, running piglet syndrome, abdominal fullness, umbilical pain. Regulates the small intestine, so indicated for diarrhea, undigested food in the stools, incontinence of stools in the elderly. REN4 strengthens the kidneys receiving of qi, like cough, coughing of blood, breathlessness. And finally, REN4 roots the mind and the ethereal soul, so it's very good for fear, fright, and insomnia. Thanks for listening.
Let's now discuss gallbladder 36, the ancestral meeting point, and accumulation or sheath left point. GB36 is 7th proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. So how to find this point? We have here a quick method. First, we can use the spreading hands technique. We locate GB35 at the midpoint of a line connecting GB34, which is in the depression anterior and inferior to the head of the fibula, and the highest prominence of the lateral malleolus on the anterior border of the fibula. The total distance would be 14 chun. GB36 is located 7 chun proximal to the prominence of the lateral malleolus. Or still using the spreading hands technique, we locate GB36 1 chun distal to the midpoint of a line connecting the popliteal crease and the highest prominence of the lateral malleolus on the anterior border of the fibula, with a distance totaling 16 chun. For orientation, the borders of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the anterior border of the fibula just superior to the ankle and then locate the point on an imaginary line running to the head of the fibula. Located on the same level are GB35 on the posterior border of the fibula and bladder 58, which is 7 chun proximal to bladder 60. GB36 is needled vertically 0.5 to 1.5 chun. Its actions and indications include regulating gallbladder and liver qi. It also drains damp heat. It relaxes the tendons and muscles and calms the shen. Special features, it is the chic left point of the gallbladder meridian. Being the accumulation point, GB36 is used in all painful conditions of the channel or organ. So in summary, GB36 removes obstruction from the channel, as in hypochondrial distension, painful obstruction syndrome or B syndrome, and atrophy or Wei syndrome of the lower leg. GB36 is the chic left point of the gallbladder channel. The chic left points are where the qi and blood, which flows relatively superficially along the channels from the gingival points, gather and plunge more deeply. The chic left points in general are indicated in the treatment of acute conditions and pain, and GB36 is indicated for pain of the skin. Thus, the systematic classic of acupuncture and Max Sebastian said, painful skin with atrophy disorder and painful obstruction principally select GB36. Unusually, this point is also indicated for rabies. The illustrated classic of acupuncture points on the bronze man said, rabies with chills and fever, quickly moxa GB36 3 times and then moxa the bitten area. So GB36 can be used in combination with DO19 for pain in the neck with aversion to wind cold. The invigorating nature of chic left accumulation points affect the mind positively, clearing and stimulating thought, bringing clarity and a fresh perspective. Qi and blood gather at chic left points. They are particularly energizing for the meridian on which they are found. Chic left points are used in acute conditions to move obstructed qi along the meridian. The potential of this chic left point on the gallbladder meridian can give strength and fluidity to those who feel insubstantial and timid or inflexible and rule-bound. As with many points on the calf, the name of this point is a reference to its location on a hill of flesh. Okay. As the chic left or accumulation point, outer mound can be used in cases of obstruction or pain in the meridian or fu, and a distal point to influence the other end of the meridian, like in cases of neck pain and stiffness, chest and hypochondria, fullness and pains. Accumulation and stagnation tend to lead to heat. This point can be used to clear heat, such as in headache, mania, and hypertension. It regulates the gallbladder, removes obstruction from channel, and relieves pain. This point also clears heat, relaxes the sinews, and resolves damp heat. GB36 is said to help aversion to wind. And finally, this point is used for first aid for rabies using moxa. Thank you for your attention.
Now we continue with the 4 C's. Stomach 36, the leg 3 miles Susan Lee. To locate stomach 36, it is 3 tune distal to stomach 35, lateral eye of the knee, and 1 finger breadth lateral to the anterior crest of the tibia on the tibialis anterior muscle. How to find? First, locate stomach 35, the lateral eye of the knee at the level of the knee joint space. From stomach 35, palpate 3 tune, 1 hand breadth down and 1 finger breadth towards the lateral by placing the middle finger adjacent to the tibial crest. There, stomach 36 is located in a depression which can be palpated dynamically. Choose the point according to the pressure sensitivity, or palpate the lower border of the tibial tuberosity and dynamically locate stomach 36, 1 finger breadth lateral to it. Needling, vertically 1 to 1.5 tune, moxibustion is often used on this point. For the action and indication, stomach 36 regulates the stomach, strengthens the spleen, transforms dampness. It tonifies qi and yang, nourishes the blood and yin. Stomach 36 calms the shen, opens the channel. The special features, it is the HT point, earth point, bend point, 5 paces point, lower HT point of the stomach, WANGU command point for disorders of the abdomen, Ma Dan Yang point, sea of water, and brain point. Main point to tonify qi and blood for general weakness, and it is a very important point. This is, of course, a major point to tonify qi and blood in deficiency pattern. It is the main point to tonify the root of post-heaven qi. That is the stomach and spleen. Although it is on the stomach channel, stomach 36 strongly tonifies spleen qi as well as stomach qi. It is used in all cases of deficiency of stomach and spleen, and to strengthen the body and mind in very debilitated person or after a chronic disease. Since it tonifies the upright qi, it also strengthens the resistance to attack from exterior pathogenic factors. It can therefore be used for prevention of attacks from exterior climatic factors. When used for prevention, moxa only is applied to this point. Some doctors recommend the use of this point with direct moxibustion every 5 to 7 days for about 10 minutes each time to strengthen the upright qi and the resistance to disease. However, this use of stomach 36 is not considered suitable for those under 30 years of age. Li Dongwon, author of the celebrated discussion of stomach and spleen, said, for old people with deficiency of qi, use stomach 36 and REN6 frequently with 50 to 60 moxa cones each time. Stomach 36 can tonify not only qi, yang, blood, and yin, but also the original qi, the yuan qi. Although the original qi resides in the kidneys and it is related to the pre-heaven qi, it relies on the stomach and spleen for its supplementation. Stomach 36 is also indicated in all deficiency patterns of the stomach, with dull epigastric pain, no appetite, etc. It also regulates the intestine, treating abdominal distension and pain, and constipation of a deficient nature. It brightens the eyes and can be used for blurred vision and declining eyesight in old age. It is also used in attack of exterior wind cold with prevalent of wind, the greater yang wind pattern of the six-stage pattern identification. To regulate nutritive and defensive qi. In this case, the exterior wind cold invades the skin and interferes with the circulation of defensive qi. The pores are open and the person sweats slightly. This situation is characterized by a weakness of nutritive qi, which causes the person to sweat. Needling stomach 36 regulates and harmonizes nutritive and defensive qi so that tonifying the former stops sweating and removes the latter, expels the pathogenic factors. When used in this way, stomach 36 is needled not with reinforcing but even method. The discussion on cold-induced diseases in clause 8 says, at the greater yang stage, if a headache persists for more than 7 days, it is because the pathogenic factor has circulated through the greater yang channel. If the pathogenic factors tend to be transmitted to the next channel, the bright yang channel needling points on the stomach channel will stop this transmission. Since it regulates nutritive and defensive qi, it is also used in all cases of edema when the defensive qi is weak in the space between skin and muscles and fluids overflow from the channel to invade the space under the skin. Stomach 36 resolves edema by consolidating the space between the skin and muscles. Used with direct moxibustion, stomach 36 raises yang and is used for prolapses in combination with REN6 and DO20. Stomach 36 is not only used as a tonifying point, but it can also be used with even or reducing method to eliminate dampness or cold. As can be seen from the indications, it also moves qi in the stomach and intestine. However, it is much more frequently used to tonify. Stomach 36 can also expel wind and dampness from the channel in painful obstruction syndrome, the B syndrome. Besides its obvious action on painful obstruction syndrome of the knee, for which it acts also as a local point, it also has an influence as a distal point for painful obstruction syndrome of the wrist. For the summary of functions, stomach 36 is the major point to tonify qi, blood, yang, yin, and the original qi. Very important in all deficiency patterns of stomach and intestine. It strengthens the upright qi, the sheng qi, and resistance to exterior pathogenic factors. Stomach 36 brightens the eyes for chronic eye diseases. It also harmonizes the nutritive and defensive qi in the exterior invasion of wind to regulate the space between the skin and muscles. It resolves edema, raises yang for prolapses, expel cold with moxibustion, and expel wind and dampness in painful obstruction syndrome, B syndrome. Thank you for your attention.
Let's now discuss kidney yin deficiency of a pattern in chronic fatigue syndrome. Clinical manifestations: soreness of the lower back, exhaustion, depression, lack of drive and willpower, weak legs and knees, dizziness, tinnitus, deafness, dry mouth and throat, which are worse at night, night sweating, disturbed sleep, waking up during the night, and thin body. Tongue without coating, pulse floating empty. Prolonged fever can injure kidney yin in people who have a pre-existing kidney weakness. Kidney yin deficiency causes the patient to feel completely exhausted. It is a type of exhaustion that cannot be relieved by a short rest, but only by regulating one's life and taking proper rest over a long period of time. On a mental level, kidney yin deficiency causes a person to feel depressed, lacking in drive and initiative, as the kidneys are the seat of willpower. Treatment principle: nourish yin, strengthen the kidneys, and firm the willpower. Points: kidney 3, lung 7, kidney 6, REN4, spleen 6, bladder 23, bladder 52, do 20, all needled with reinforcing method, no moxa. Kidney 3 is the source point and it nourishes kidney yin. Lung 7 and kidney 6, in combination, open the directing vessel, nourish kidney yin, and moisten the throat. REN4 and spleen 6 nourish kidney yin and benefit fluids. Bladder 23 and bladder 52 in combination strengthen willpower and can improve drive and determination. Do 20 clears the brain and lifts the mood. Now, let's discuss the case history of a 59-year-old woman who had been diagnosed as having had chronic fatigue syndrome for the previous 4 years. She could not say exactly how it started. Her main symptoms when she came for treatment were feeling flat, constipation, raising feeling with palpitations, ache and fatigue of muscles after the slightest exertion, exhaustion, lacking energy and incentive, passing water 3 times a night, backache, dizziness, tinnitus, feeling cold, breathlessness with palpitations, cold hands, flu-like feeling like a burning coldness, and she was prone to catching colds after a shower or washing hair. Her tongue was pale with a slightly peeled center and a central stomach crack. Her pulse was generally weak. Diagnosis. Most of her symptoms indicate kidney yang deficiency. Backache, dizziness, tinnitus, feeling cold, lacking incentive, constipation, and nocturia. Kidney yang is the root of heart yang, and deficiency of the kidney yang often leads to deficiency of heart yang. Hence the palpitations with racing feeling and breathlessness. There is also some residual dampness in the muscles, evidenced by the ache, but this is quite secondary in relation to the general yang deficiency. The main principle of treatment is therefore tonify kidney yang and only secondarily to resolve dampness. She was given acupuncture to tonify spleen and kidney yang and resolve dampness using mostly stomach 36, spleen 6, bladder 20, bladder 21 to tonify spleen yang with moxa, bladder 23 and kidney 7 to tonify kidney yang with moxa, and spleen 9 to resolve dampness. Thank you so much for your attention.